1. Which adult learning principle is most applicable when training psychiatric rehabilitation practitioners to support client recovery goals? A. Learning is most effective when it follows rigid instruction. B. Adults learn best when training connects to their personal and professional experiences. C. Learning should be limited to theoretical frameworks. D. Adults require frequent repetition regardless of relevance. 2. When developing a CPRP training curriculum, which strategy ensures alignment with certification standards? A. Relying solely on organizational preferences. B. Integrating SAMHSA's recovery-oriented principles into course outcomes. C. Reducing emphasis on national standards to allow flexibility. D. Using outdated materials for historical context. 3. In psychiatric rehabilitation education, formative assessments primarily help trainers A. Evaluate certification exam eligibility. B. Adjust instruction to improve ongoing learning outcomes. C. Eliminate underperforming participants. D. Assign final competency scores. 4. Which communication skill is most critical for a CPRP when addressing client relapse or regression? A. Passive listening to avoid confrontation. B. Directive communication focusing only on compliance. C. Empathic listening and motivational interviewing techniques. D. Technical explanations of psychiatric symptoms. 5. Adult learners in CPRP programs are more likely to stay engaged when A. The content is theoretical and abstract. B. Instruction connects to real-life client case studies. C. Participation is discouraged to maintain authority. D. Assessments are purely memorization-based. 6. When mentoring new psychiatric rehabilitation staff, the best approach to skill transfer is A. Allowing independent trial without supervision. B. Modeling best practices and providing guided reflection. C. Relying exclusively on written manuals. D. Using punitive correction for errors. 7. The evaluation of CPRP trainees should focus primarily on memorization of diagnostic codes. B. Demonstrated application of recovery-oriented practices. C. Knowledge of administrative policy only. D. General counseling theory without practice. 8. A curriculum based on adult learning theory should A. Be flexible and self-directed. B. Be identical for all participants, regardless of background. C. Focus solely on lecture delivery. D. Avoid interactive discussion. 9. In psychiatric rehabilitation, effective communication across multidisciplinary teams requires A. Shared vocabulary and respect for each professional's scope. B. Rigid adherence to one discipline's perspective. C. Exclusive communication through written reports. D. Avoidance of collaboration to prevent overlap. 10. To ensure regulatory compliance, a CPRP must maintain A. Documentation consistent with HIPAA and ethical codes. B. Client data shared freely among providers. C. Notes with subjective personal opinions. D. Verbal-only case updates. 11. When evaluating a CPRP trainee's learning outcome, the most reliable assessment tool is A. Peer gossip about performance. B. Structured competency-based evaluation checklist. C. Ungraded discussion participation. D. Attendance record alone. 12. Which principle of adult learning emphasizes the value of intrinsic motivation in CPRP training? Andragogy. Behaviorism. C. Classical conditioning. Deconstructivism. 13. A key component of curriculum development for psychiatric rehabilitation is A. Embedding trauma-informed care principles. B. Minimizing client-centered approaches. C. Focusing primarily on diagnosis-based models. D. Limiting cultural sensitivity topics. 14. Mentoring relationships in psychiatric rehabilitation are most effective when A. Based on mutual respect and shared goals. B. Hierarchical and authoritarian. C. Focused only on administrative tasks. D. Time-limited and impersonal. 15. Which teaching strategy supports retention for adult learners preparing for CPRP certification? A. Using experiential learning and reflective practice. B. Providing information only through lectures. C. Avoiding feedback until the final exam. D. Focusing on rote recall of regulations. 16. When reviewing ethical decision-making in training, the best learning method involves A. Analyzing case studies and applying the code of ethics. B. Reading the code without discussion. C. Ignoring ethics to focus on clinical tasks. D. Memorizing laws without application. 17. A CPRP educator ensures inclusivity by A. Adapting materials for diverse cultural and linguistic needs. B. Using a single standard model for all participants. C. Ignoring learner feedback. D. Focusing solely on Western treatment frameworks. 18. In competency evaluation, reliability refers to A. Consistency of scoring across evaluators and settings. B. The accuracy of learners' self-perception. C. The speed of assessment completion. D. The creativity of assessment design. 19. During supervision, a CPRP mentor promotes self-efficacy by A. Encouraging reflection and problem-solving. B. Providing prescriptive answers to every question. C. Criticizing mistakes harshly. D. Withholding positive feedback. 20. When documenting client progress, the CPRP must ensure A. Objectivity, confidentiality, and professional accuracy. B. Emotional tone to show empathy. C. Minimal detail for time efficiency. D. Informal notes for personal reference. 21. Effective evaluation in CPRP training combines A. Knowledge testing, skill demonstration, and reflective assessment. B. Memorization and attendance tracking. C. Peer opinion and self-assessment only. D. Supervisor impressions without evidence. 22. Which best defines outcome-based education in psychiatric rehabilitation? A. Curriculum focused on measurable behavioral competencies. B. Curriculum based on time spent learning. C. Learning outcomes defined by subjective trainer impressions. D. Content focused exclusively on theory. 23. To address adult learners' readiness to learn, CPRP trainers should A. Connect instruction to immediate job relevance. B. Require completion of all readings before engagement. C. Delay feedback until program completion. D. Use abstract exercises unrelated to practice. 24. Regulatory compliance in psychiatric rehabilitation requires CPRPs to A. Follow federal, state, and ethical standards in service delivery. B. Rely solely on employer policies. C. Substitute documentation standards as needed. D. Minimize accountability for confidentiality. 25. A feedback model that supports adult learning is A. Timely, specific, and solution-focused. B. General and delayed until the end. C. Vague but frequent. D. Limited to formal evaluations. 26. Which instructional approach aligns with experiential learning principles? A. Simulations and role-playing of client interactions. B. Reading and summarizing policy documents. C. Lecture-based knowledge transfer. D. Repetition of textbook definitions. 27. A major goal of mentoring in CPRP development is to cultivate professional identity and reflective competence. B. Reinforce dependency on the mentor. C. Emphasize performance over personal growth. D. Avoid emotional intelligence discussions. 28. Effective CPRP curricula incorporate evaluation tools that A. Measure both knowledge and practical application. B. Focus solely on test performance. C. Rely on subjective instructor opinions. D. Assess theory without demonstration. 29. When teaching about recovery-oriented care, the most engaging strategy is A. Using client success stories to illustrate principles. B. Requiring memorization of the recovery model. C. Avoiding emotional content to maintain neutrality. D. Focusing on pathology rather than progress. 30. Which factor most improves adult learning retention in psychiatric rehabilitation? A. Immediate application of new skills in real settings. B. Extended theory-based lectures. C. Multiple choice testing only. D. Group observation without practice. 31. Ethical mentoring practice includes A. Maintaining boundaries, confidentiality, and professional respect. B. Sharing personal client information. C. Becoming a friend rather than a mentor. D. Ignoring ethical dilemmas to maintain harmony. 32. A reflective journal in CPRP training primarily helps learners A. Integrate theory with real-world practice and self-assessment. B. Record unrelated personal thoughts. C. Replace supervision. D. Demonstrate attendance. 33. When designing a performance evaluation tool for CPRP trainees, the most important criterion is A. Validity, measuring the skills it intends to assess. B. Attractiveness of the form. C. Length of the questionnaire. D. Level of difficulty. 34. Which of the following best describes the primary role of a CPRP in a community-based mental health program? A. To provide direct medical treatment to individuals with psychiatric conditions. B. To design rehabilitation plans that promote recovery, independence, and social integration. C. To supervise clinical staff and ensure medication compliance. D. To focus primarily on crisis intervention and acute stabilization.